Hey there, I'm Bayu from Group 3, 12 in Jakarta School of Prosthetic and Orthotic. Okay, in this time I want to explain about pathological gait with my friends Azia, Icha, and Melissa. Let's check this out. The first is definition. Pathological gait is a term used when there is abnormality, gait, or deviation of a person compared to normal body. There are many types of pathological gait, but in this video, we will talk about antalgic gait, hemiplegic gait, and diplegic gait.
Hello everyone, my name is Azia Sharpina from Jakarta School of Prosthetic and Orthotics. In this video, I will explain about hemiplegic gait. So, what is hemiplegic gait? Hemiplegic gait is unilateral weakness on affected side. Arm swing is absent throughout gait cycle. And for the causes of this pathological gait is stroke and brain trauma. The phase of hemiplegic gait during swing phase, the affected leg will rotate outward due to weakness of hip flexion. How to observe the hemiplegic gait? We can see from coronal plane, the arm is adduction, the wrist is flexion, and the finger is flexion, and the shoulder is internal rotation. For the hip joint is internal rotation, and subtalar joint is inversion. And for the sagittal plane, the elbow joint is flexion, the hip joint is extension, the knee is hyperextension, and the ankle joint is plantar flexion. For the GRF or ground reaction force in hemiplegic gait, the GRF is passed through posterior to ankle joint, anterior to knee joint, and posterior to hip joint.
Hello guys, my name is Shelly Petria. I'm from Polytechnic of Health Science Jakarta 1, Ministry of Health of Republic Indonesia, and I'm from Prosthetic and Orthotic Department. So now, I will explain and demonstrate about diplegic gait. Diplegic gait is when the patient have involvement of both sides with spasticity on lower extremity worse than upper extremity. And diplegic gait is similar with scissor gait. And for the particular position of diplegic gait are flexion of the hip, flexion of the knee, and for the feet and ankles are rotated internally and extended. Causes diplegic gait because the brain is damaged that inhibits the development of motor neuron function that makes impact of the motor cortex. So now, I want to demonstrate how to someone have diplegic gait.
I will show you how to assessment for spasticity. First, place patient in supine position. And because hemiplegic gait, the patient have plantar flexor spasticity, so I will check the plantar flexor spasticity. And we will give quick steps to dorsiflexion. This is how to check spasticity in knee extensor. We will give quick stretch to knee flexion.
To perform this test, have your patient in supine-lying position with his hips and knees flexed to 90 degrees. Then you can ask your patient to stabilize this position behind his knees and ask him to extend his knees in turn as much as possible. Yeah, and the other one. Okay. This test is positive if your patient does not come further than within 20 degrees of full extension. So in this case, we would talk about a slight contracture of the hamstrings.
Dorsiflexion of the ankle is limited with tightness of the gastrocnemius muscle. The gastrocnemius muscle spans across the knee joint. The gastrocnemius muscle relaxes with flexion of the knee, and this improves the ankle dorsiflexion. This knee flexion test measures the range of ankle dorsiflexion with the knee flexed and the knee straight. More ankle dorsiflexion with the knee flexed indicates gastrocnemius tightness.
Okay. Then ask your patient to bring his knee as far to the chest as possible and to hold it afterwards. And ask him if he can feel a stretch in the right groin. Okay. With a positive test, you will see that the extended leg is lifting off the table, like in this case. You can even measure the angle at the knee as a reference. Okay?
My name is Melissa Kumala Triwirawan from the Fintech at Jakarta School Prosthetic and Orthotic. I want to explain about the analgesic gait. Analgesic gait is a painful gait. A patient with analgesic gait does not want to spend time on the one leg due to the pain. The characteristic of gait resulting from pain during weight bearing to avoid pain. The person shorten time in stand pace of the affected limb. As a result, step length become longer. Process for analgesic gait is painful of the limb. For the any pathologies such as rheumatoid arthritis and osteoid arthritis, which is cause pain on the affected limb. Analgesic gait is we can observe the analgesic gait in sagittal plane by looking the affected leg in the stand pace. Short time in the stand pace causes the person need to avoid pain during weight bearing. DRF analgesic gait during stand pace, medial direction, and the upper body oblique to normal leg to reach stability.
That's all our explanation. Thanks for watching and see ya!